Hello everybody. Once you hear the title of this video, you'll appreciate why I wanted to shoot it initially underneath a broomstick in my bed with the sheets coming over the side. Why is that, I hear you ask? Quite simply, today's title is Intent, Presence and the Craft of Modern Chiropractic. Hello. My name is Aidan from Encouraging Chiropractic Training, and I want to share some reflections after what has truly been an exceptional weekend with a fantastic group of chiropractors in London this December 2025. We spent 2 full days together, not only working on our technique, refining motion palpation and of course the art of the adjustment, but actually going deeper into something that underpins everything that we as primary contact practitioners do. Intent, presence, awareness, the inner world of the chiropractor. Because the truth, of course, as you know, is this: you can know every technique, listing, line of drive, but if your intent is off, if your presence is scattered, if your awareness is dim for whatever reason, then your technique will never shine the way that it in fact could. So, why do patients come to us? And why presence, yours, is the first adjustment. Remember, when someone comes to see you, they aren't arriving at your door because everything is going swimmingly. They're not coming in because they've read your CV. They're not coming in because they like your haircut or website or even your accent. They're coming because something hurts. Something isn't working the way that they expect. They're worried, frustrated, and as you know, they'll be tired of not feeling like themselves. Now, of course, in an ideal world, people would come to see us before the pain starts. They treat their bodies like they treat their car, with regular MOTs, tune-ups and proactive care. But that's not the reality, is it? Pain is often the first language that our patients speak. And our job, which is our responsibility, is to meet them exactly where they are, not where we wish that they were. And that means that your presence, your genuinely grounded presence, is the first adjustment that you will ever deliver. That means it will happen before you lay a hand on them, before you take a case history, before you do the motion palpation, before the thrust, before all of that stuff. They're already going to be asking, are you here with me? Can I trust you? Do you understand me? But are you listening? And I mean really listening. You cannot fake that. Patients will feel it immediately. And remember that a chiropractor's presence is communicated through the calmness of your breath, which means your voice, the way you are in the room, your posture, your eye contact, how rapidly or slowly you move, and the micro pauses that tell them that you're thinking, listening to them and not rushing. Because before a single technique is applied, you are already shaping the therapeutic environment that that person will find themselves in, and by default the outcome. So your mindset affects their nervous system. Remember, patients and us are constantly scanning each other, not consciously, but neurologically. All our autonomic nervous systems are assessing the safety of the place, the safety of the person, their threat or not, their warmth or not, their competence or not, and their empathy or not. And if they sense some tension in you, then they will of course become tense. If they sense hurry, they brace. If they sense doubt in you, they become uncertain. But if they sense clarity, calmness, and that you being present in the room, then their nervous system will begin to settle a little. Now, this isn't philosophy, it's just physiology. Your ventral vagus, facial cues, tone of voice, breathing rhythms, all of these create a non-verbal conversation long before you say a word. This is why your presence matters. This is why your intention matters. You are not adjusting spines or joints. You are interacting with an already antagonized nervous system. So we need to create the art of listening, which is actually way harder than it sounds. Listening is easy. Hearing is perhaps easy, but listening without your mind jumping ahead, that is listening to what the patient's saying right there, that takes discipline. So when a patient talks, of course, we know our brain automatically goes, here's a problem. I want to solve that problem. I want to diagnose that problem, fix it, categorize, perhaps plan your next question. You're already maybe thinking about your next appointment. You might be running behind. You want to just get ahead of them. But remember that true listening is staying with the patient's words for long enough for meaning between you and them to form. And when you do that, then three things happen. Number one, they will feel acknowledged. Number two, they'll feel understood. And number three, they'll finally feel safe enough to tell you what is really going on. Your presence of safety opens the door to honesty. Honesty opens the door to clarity, and clarity opens the door to effective chiropractic care. So what is communication? I believe it's the most undervalued clinical skill. If you have clear, simple, compassionate communication, this is not a nice extra. It is the treatment. It is part of the treatment, but it is the treatment. Patients don't need to hear you say words in Latin, and they don't need the technicalities of every joint movement. But what they do need is assurance, clarity, understanding, and a sense of overall direction. So when you speak plainly and confidently, you're not dumbing it down, you're creating a partnership with the other person. When you explain what you're doing, why you're doing it, what they can expect to feel, and the outcome, you invite them into the process. So that means that the adjustment becomes something that is done with them, not to them. We can express this through technical intent, which is the physical expression of your thought. So let's talk about technique, because this, of course, is where your intent will become physical. And literally everything you do physically communicates intent, not just to your patients, but to other people as well. Your stance, foot position, how you approach the table, where's the bench height, where's your center of gravity, how much tension is in their hands, or your hands, how much slack do you take, where is your speed, your amplitude, your follow through, your direction. A thrust without clear intent is like a sentence without grammar. Messy, confusing, and ultimately lackluster. But if you can give clear intent, you're going to get a clean, elegant, efficient, and effective treatment. You're not wasting motion, you know, to overpower the patient or yourself, and every part of your body from your feet up contributes to the unified direction of drive. Now, this is what I teach and encourage in chiropractic training, not just how to adjust, but how to build intent into the adjustments so that the adjustment itself as a whole has meaning. So what are the patient's non-verbal cues? These, in fact, are your most valuable feedback. We already know not every patient will tell you verbally when something is wrong, but believe me, they will tell you non-verbally. A small flinch, a tightening of breath, a subtle pull away, eyes narrowing, an increase in muscle tone, or a hesitancy as they reposition. And if you are present in the room right then, you'll notice these. If you're distracted, you miss them. And missing them can lead you to treat when you should pause. Of course, a good adjustment requires confidence. A great adjustment requires sensitivity to the situation. So what did I see this weekend, and why has it mattered? Why am I doing this video? This weekend in London, the group of chiropractors who came together brought something really special, which was a genuine willingness to learn, refine, to self-reflect, and to evaluate their craft. As a group, they practiced slowing down, tuning in, reading the patient, grounding themselves, and adjusting with calm and steady hands. They also ask better questions, thinking not just about the what am I, but why am I doing? And I am, of course, genuinely grateful for that. Because when chiropractors take their presence as seriously as their technique, the standard of care in the profession rises. Confidence will rise, outcomes will rise, and the patient experience will transform. So, what are my final thoughts? Well, here's my message to you. The next time you step into your treatment room, don't just prepare your hands, prepare yourself and your presence. Before you interact with the patient, adjust your own state. Maybe take a deep breath, take a pause, take a reminder that this person is my entire world for the next few minutes. Because if you bring your full presence and full intent and full awareness, you will see a change. Patients may come to you because they're in pain, but they will stay with you because they feel cared for, safe, understood, and most importantly, respected. And that's what encouraging chiropractic training is all about. Of course, we're refining the hands, but we're sharpening the mind and elevating the presence of the modern chiropractor. Thank you, genuinely, for giving me the opportunity to share these thoughts, and for everyone who came this weekend ready to learn. You make this profession better. If you'd like to know more, please don't hesitate to hit that like button, subscribe, and follow for more updates from Enchiridion Chiropractic Training. I've been Aidan, and I'm saying to you, bye-bye, and stay focused. In fact, stay intent.